everyone, welcome back to my channel. I'm AJ Yemoh, and today I have here with me one of the finest Ghanaian doctor, and we are here to talk about everything about pregnancy, prenatal, antenatal, and postnatal, and also C-section, also known as cesarean section.
Hey, 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 Mabina.
So if you are new here, my channel is all about lifestyle, vlogs, and inspiration. So don't forget to hit that subscribe button and let's keep going together. So I call this daughter an angel because she played a vital role at the latter part of my pregnancy and also after delivery. And she's in person of Dr. Gifty. Dr. Gifty, you're welcome to my channel.
Thank you. Hi, guys.
So Dr. Gifty, can you please tell us a little bit about yourself and also your field of specialty in the medical fraternity?
So my name is Gifty. I'm a senior house officer in a government hospital in Ghana. And right now, I don't really have a specialty. So what happens is you go through 6 years of medical school in Ghana. And then after the 6 years, you're supposed to have like a national service to serve your government for 2 years. So we call it house job. So after the first year, then you have a second year. Then afterwards, you can become an MO or you can just go straight to specialize. Yes, so I'm a senior house officer. I have a few months left. Then I'll be done with house job. Anyone who has been through medical school in Ghana and has gone through house job knows the stress of it. So I'm glad I'm about to end. Yeah.
Okay, Dr. Gifty, thanks so much. So Dr. Gifty, this is very funny. I know when I was growing up, my parents wanted me to become a doctor. But when I grew up, I'm nowhere closer to the medical service.
Yeah.
The medical area. But so I want to know whether this profession was imposed on you by your parents or...
I wouldn't say no, and I wouldn't say yes. I know as a child, I always admired people in white coats. I felt like those people were so exceptional. Their white coats were always white, very neat. And then I felt that we were very intelligent people. So I always admired them. And maybe jokingly, I used to say, oh, I want to be a doctor, but I didn't really mean it. Okay. Till once, I think we're all playing as kids, and one of my cousins asked me what I wanted to do. I said, oh, I want to be a doctor. And then she laughed. Because she was like, see, you're not one of the intelligent people. I mean, people who want to be doctors or who are doctors used to be first in their class, second, third. And Charlie, I wasn't one of them. So she just discouraged me. But I think later on I spoke to my mother. She pushed me. She bought me all the books I needed in school. And I was having extra classes most of the time. So yeah, if my mom is watching, she has done a very good job. And so yes, that's the influence my parents played. Yeah, so yes and no.
Okay, yeah. So we would say it was somehow imposed, or you took it like it was your passion. Somehow imposed, and also it was your passion too.
Yes, let's take it like that.
Guys, as I said earlier on, that we'll be talking about prenatal, postnatal, and antenatal. So Dr. Gifty, what's your take on all these things?
So yes, ideally, before any woman should get pregnant or wants to get pregnant, you're supposed to prepare your body for pregnancy, and that's what we call prenatal care or preconception care. And then when you get pregnant, you're supposed to also prepare your body or adjust your body to the pregnancy. That's antenatal care. And then postnatal is after you delivered or after you've given birth to the child. Yes, so I'll try to not be so medical. I'll try to talk so that everybody will understand what I'm saying. So for prenatal care or preconception care, it's when a woman wants to conceive. I mean, it's as simple as that. Okay. And then first of all, if you want to conceive, you're first supposed to find out if you have any underlying medical conditions, for instance, hypertension, diabetes, and most importantly, sickle cell. Because sickle cell in pregnancy is a whole ball game on its own. We have different genotypes for sickle cell. We have SS, the common ones in Ghana, SS and SC. But SS is very severe, especially in pregnancy. SC, some people don't really get crisis, but SS. So if you know you have sickle cell, I advise that before you even think of conceiving, see a doctor first, and then let the doctor help you as to how you should go about stuff. So if you check all the medical conditions and you are good to go, then you can start the preconception care, which is mostly taking folic acid. And what folic acid does is it helps to prepare your body to prevent any kind of malformations when the baby is growing and all that. So that's preconception care. And it's if you want to conceive, I think the best thing you want to do is start with preconception care. Not just wait and say, I want to be pregnant, then boom, you are pregnant. No. I think some people don't even plan to get pregnant, but it just happens. That one is fine. I mean, no, I didn't plan. But Charlie, if you really want to get pregnant, or maybe from now to December, I want to conceive, you can start the preconception care. If you know you are getting married, you want to conceive in the first year of pregnancy, you can just start with the preconception care.
Okay, so you taking folic acid when you are not pregnant, doesn't it have
any effect on your body? No, it doesn't. For now, of course, every medication is a combination of chemicals, which has its own effects. But the positive sides of the folic acid outweighs the negative side. Let me just put it that way. So it doesn't necessarily have any effect if you take it for a short period, maybe 3 months, 4 months, 5 months. But if you are taking folic acid to be pregnant for maybe 4 years, 5 years, then you should know that probably there's something else. So we can evaluate on that one.
So when you are pregnant, what should you do?
So when you are pregnant, when you find out that finally I'm there, or mistakenly I'm there, because some people don't plan it. I will not say mistakenly, but actually you've seen that maybe you missed your period or you're experiencing something unusual, and you go to the hospital or you go to the pharmacy to get this test kit and it's positive. Please, no matter who you are, no matter how healthy you are, just start antenatal care. Sometimes you go in very early and they'll tell you that, maybe you should come back in 6 weeks. For instance, if you go before 10 weeks, they'll give you a longer date for you to come for the subsequent antenatals. But
why do they do that?
So because in early pregnancy, you don't really pick up much from a scan if you should do a scan. So what we'll do is you start with your folic acid or something, but then we will actually monitor you when we start picking up signs from the scan. And then this is for those who don't have any medical conditions. If you have a medical condition, right from the onset, we'll start monitoring you. That is just the basics. So if you can, and if you want to have a very safe pregnancy, I'm not saying antenatal gives you safe pregnancy. I'm not saying that. I'm not God. I mean, anything can happen in pregnancy. Some things medicine cannot even explain. But for what I know, if you want to just be safe, on a safe path or a track, just start your antenatal care whenever you miss your period, whenever you find out you're pregnant, and please follow the days that they ask you to come for review. Don't go for review based on how you feel. They said I should come on Tuesday, but this Tuesday I feel like sleeping, so I'll go the following Tuesday. Please don't do that. So that's antenatal care. And in the course of antenatal care, we do a lot of things. I know AJ will tell you because she has gone through it. So I mean, you do a lot of scans. That one is uncountable, especially if you approach the last trimester, or if you're in the last trimester, you do a lot of scans. Ideally 2 weeks, every 2 weeks. So we let you do the scans. There are some labs we let you do. And very importantly, the very first antenatal visit you go for, they let you do a lot of labs. They check your full blood counts, which is, should I say your total blood in your system? Because I want to explain
you make it so down for that we all understand.
So full blood counts is they want to check everything, your blood level. Let me put it that way.
Yes.
That's the most important thing we pick up. We check your full blood count. We'll check your liver function. We'll check your kidney function. We'll check if you have any. We'll check your sickling status, as I mentioned earlier. If you have any sickling in you or not. There are other things we check for. We check for STIs and all those things. So in as much as you want to have a safe pregnancy, it also helps in evaluating yourself, whether you are okay yourself. Do you understand? So that's very important. So the first time you find out you're pregnant, I'm hammering on this point. Please go to the hospital. And then,
So postnatal.
So for postnatal, it's also very, very important, depending on the mode of delivery you had. So for instance, if you had a cesarean section, you have to go for postnatal after a week after the cesarean section. then the following week, then maybe 2 weeks after,
Okay.
then eventually the wound heals and we'll know that there's nothing wrong. If you had a vaginal delivery, depending on how that also went, whether you had an episiotomy or not, postnatal is very important. I know most women don't even show up for postnatal care. Once they have the baby, they forget about everything pregnancy related. And
That's
then
what we want
yeah,
to
and postnatal to those. It's very important for those who didn't get the opportunity to go for antenatal. I know there are some people, yes, you'll be amazed, some people don't go for antenatal at all. And they give birth and everything is fine with the baby. Some too, they don't get so lucky. They didn't take any supplements, nothing, and they are fine. Some don't get lucky too. But then I'm saying that it's also, postnatal is very important for people that didn't get to go for antenatal, because we are able to now let you do all the labs that you're supposed to do initially to find out if you yourself you're okay, if the baby is doing well. Then we'll educate you on how to breastfeed. You know, antenatal, you go through all this breastfeeding education, how to even bath your baby, how to dress the baby and all that. And then if you don't want to breastfeed, how, if you want to give supplements, I mean, we give all those kind of talks for antenatal. So if you don't go for antenatal, postnatal is opportunity to go through all that teaching, and we'll
So
also
guys,
evaluate the baby for postnatal. Not just, we will just check on the baby as well.
So guys, as you've heard from her, every step is crucial. Every step is important. So don't skip anything. Dr. Gifty, I know with this one, you've already said it well when you were talking about the postnatal, prenatal, and antenatal. I know you've already said, but I still want to ask, if no, someone did not get it well, the challenges associated with postnatal, antenatal, and
Okay, so some of the medical conditions you
Yes.
can have. So as I mentioned earlier, someone who's hypertensive or diabetic, even before pregnancy, or someone with sickle cell, those are the most important things. And then these are the conditions we see almost every time at the clinic. So yeah, someone who has that would want to start preconception care
okay.
very early. And for instance, if you're diabetic, you want to control your sugars, you want to change the medication, because some of the diabetic medications are contraindicated in pregnancy. So you want to also do all those things before you try to conceive. And once you conceive, some people may not have anything, but after some weeks, after 20 weeks, after 28 weeks, after 28 weeks, not 20, after 28 weeks, 32 weeks, they start experiencing maybe their BPs to be high or something.
Okay.
However, there's something called normal physiology in pregnancy. Depending on the trimester you are in, your BPs fluctuate, your pulse fluctuates, your respiratory rate fluctuates. But when you come for antenatal, that's why antenatal is very important. When you come for antenatal, you see that for the past 4 weeks, after you were 28 weeks, maybe from 4 weeks, your BP has been acting funny. Then maybe we'll ask you to do a glucose profile, a BP profile, sorry. BP profile is we check your BP in the morning and the evening.
Okay.
So if you realize that your BP is high, maybe about 140/90, we'll start your antihypertensives. And sometimes some people may have normal BPs too, and then maybe they'll be having headaches, frequent headaches. There's something we call visual disturbance, or they'll be seeing tutu. Let me put it that way. I'm trying to be clean.
Yeah, just be
And then they're having tummy pains, epigastric pain over here. And yeah, sometimes they'll have some urinary infections and all that. Those are some things we take very, very important. Like, those are very important things we as clinicians acknowledge. For someone who has persistent headaches, we want to know what is causing the headache. Someone cannot have been having persistent headache for 2 weeks. No. So we want to check the BP. And most of the time, if not all the time, it's from the BP. So we'll know that sometimes when they even see a clinician, I know some patients, when they come to the hospital, once they enter the hospital, their BP goes high. So we want to also monitor the BP and see, because if you don't control your BP very well, it's a very, 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 very dangerous thing to do. And that can lead to something else.
Oh, okay.
Yeah, so that is very, very dangerous. And then also, if you are diabetic or in the course of your pregnancy, you realize that your sugar levels are high, we can also manage you. Sometimes the people may need admission to regulate the sugar level before you go home. Because if you have high sugar levels, it has its effect on the baby.
Oh, okay.
Yeah, it can cause what we call congenital anomaly. So the baby will be born may not be formed properly, and sometimes the babies become big, like a big baby. Sometimes you have a very small baby associated with diabetes, and almighty sickle cell. I mean, sickle cell is a whole ball game on it. Like I said earlier, so antenatal care very important, especially for everybody, not for just me, for every, especially it's for everybody, not for just those with
medical conditions.
No, it's for everyone.
Okay.
And then postnatal, we can have postnatal increase in BP as well. Don't think because you've given birth, so your BP, no. Once it's within 6 weeks of delivery, your BPs can shoot. So that's what we call postpartum eclampsia or preeclampsia. Increase in BP in pregnancy is after a certain number of weeks is preeclampsia. Then when you get very severe features, it becomes eclampsia. So we have postnatal complications, we have antenatal complications.
Oh my goodness, pregnancy is a whole thing, a whole business on its own.
It is. It's really.
So Dr. Gifty, I know there's a whole lot of beliefs and myths surrounding pregnancy. And if you've heard of any, what's your take on that?
I mean, we are all Ghanaians. We are from Ghana. We all have traditional aspects of our system. I mean, so I've heard of some, maybe a few. Not so, maybe one or two. But my take on it, I mean, do what you believe in. But I don't really. I can't relate it to medicine. Okay. I think at the antenatal clinic, there have been a few instances where women rub garlic on their belly.
Really?
Yeah, that they said it's a Sax bad spirit or something, or Sax disease. Or, yeah. So some people also drink some herbal medications, herbal preparations, because it helps to do that. I mean,
but doesn't that endanger them?
So what we do is we don't impose knowledge on people. We tell them what we know, and then.
So it's up to you.
Exactly. So I'll tell you that, for this I know of this. Some actually think you're lying. They're like, Especially if. So you see, when they come to the antenatal clinic, some women expect elderly people, and when they see, and most of my colleagues, we are young. So when they see us, they're like, this child telling me that. I mean, my grandmother is the one giving me this, and you are telling me who is more knowledgeable. So you just advise them. Some will take it, some will not. Some will not even listen to what you are saying. Will ask you to end it.
Okay, so you just do your job.
Yeah, and then for postnatal or postpartum, I've seen chameleon. Something.
They just wrap it at the
wrist
of the baby.
That it also prevents bad spell or something like that.
Okay.
I'm not sure really what it does, but I think it used to work for some mothers, because I used to see when I was in medical school, where I trained, I used to see very ill babies. They come in, they have this thing there. Some make it, some still don't anyways. But I'm saying that
it's up to you.
Yes, it's your beliefs. Yeah.
Okay, so she just does her job. She will just advise
and I'll educate you.
Yeah.
I'll tell you what I know.
Okay, thanks so much, Dr. Gifty. So, Dr. Gifty, with this question, it's very, very important. Is it advisable to breastfeed your child immediately your child comes out?
So, what...
The video is very lengthy, so we decided to split it into two. And the continuation is already on my channel, or you can check to see if it has been uploaded on my channel. So thanks so much guys for watching this video. So until next time, it's AJ Yemoh.